Scientists want to create the world's largest database of genomic information from people with African ancestry. Right now, researchers say less than 2% of genetic material studied today come from Black people. This project hopes to change that by collecting DNA from 500,000 people of African descent. The Diaspora Human Genomics Institute at Meharry Medical College in Nashville will be in charge of the genetic information. And historically Black colleges and universities across the country have signed up to help. Dr. Rick Kittles is here to tell us more about it. He's the inaugural Senior Vice President for Research at the Morehouse School of Medicine. As a Morehouse man, it feels great to hear that we have you. Dr. Kittles, first things first, Meharry Medical College cites a statistic from the NIH. We mentioned it here. Less than 2% of genetic information being studied comes from Black folks. Why exactly is that?
Well, that's because historically there's been a lack of focus in terms of studying diverse populations, in particular genetic research. And so because of that historical sort of under focus, the databases that are available lack diverse data.
We'll get to that bit of underrepresentation and under focus, but for our audience and for my own knowledge here, what is the value of having our genetic material? How exactly could it translate to, as the Associated Press put it, new medicines and diagnostic tests? What's a good example of this?
Well, right now clinicians are leveraging genetic data more and more, in particular for clinical decision making. And so when you think about many of these cardiovascular diseases and cancer ailments, a lot of the genetic material that individuals have is being leveraged now to design drugs, and then also to diagnose earlier.
So what you're saying here is that with this genetic material, new medicines, new ways of diagnosing diseases and things of the like could be something that helps with treatment and care of people from different backgrounds, especially folks of African ancestry. Is that what you're saying here?
Yeah, that's exactly why this is so interesting and so important. When we think about the impact that genetics is going to have on disease and health of diverse communities, this particular project and program is very exciting.
Yeah. This is from the Vice President of Regeneron. People of African ancestry have been underrepresented in genomics studies. This is something you said just a bit ago. What have been some challenges in actually getting people to participate in studies like this? Why is this such a big hurdle?
Well, because of the lack of attention and being underserved in healthcare and in research, many African American individuals and families, communities, really are not well connected with the research enterprise. And so because of things like the Tuskegee experiment, things like the Henrietta Lacks story, many African Americans are resistant to participate in these sorts of studies. And that's another reason why this is important, that this is being led by historically Black medical schools like Meharry.
I'm glad you mentioned the Tuskegee syphilis study, the Henrietta Lacks story. These are things that a lot of Black people will mention, a lot of researchers will mention when it comes to hesitancy with Black folks actually participating in studies, hesitancy with medicine and things of the like. But that was decades ago. So I'm curious to know what's the holdup now? What are some of the things that are really getting in the way of the medical practitioners, the industry, actually getting to these communities and making sure that they are part of these studies that could help them going forward?
Well, I think we have to understand that the barriers to participation in many of these studies is due to multiple issues, and part of it is historic. And so if you have over 10, 20, 30, 50 years of isolation, non-participation because individuals were not asked to participate in these studies, or individuals that were asked were either scared or didn't understand what the research project was under, what was going on with the research project. And so there are a lot of issues beyond just, the present day situation. If you go to any African American family today, many of them will raise this issue of the Tuskegee syphilis study, even though they may not know the details, even though they may not actually even understand sort of the issues. They still remember, the story, and which has caused in many cases many of them to not want to participate and not want to be seen as guinea pigs in the research.
With the last 30 seconds we have here, I want to make sure we get to this. What's the solution here? There's $20 million going toward this effort, which includes an educational component. With the last 30 seconds, what's the solution for making sure that more Black folks are participating in studies like this?
Well, I think the strategy that's being used now by Regeneron is one way that we can, I believe, actively engage and get African Americans to participate. Partnering, doing a sort of what we call a public-private or public partnership with the historically Black college is important, and that has some saliency in the community. There'll be a lot of individuals who will trust the research because of Meharry Medical College being active players and the data being housed there, and also the training of African American scientists. So all of that is very important in the in this whole recipe of success for engagement of African Americans in genetic research.
Dr. Rick Kittles, inaugural Senior Vice President for Research at Morehouse School of Medicine. Thank you so much for your time. Dell?
See, because